This audio program by Radio AI is generated using artificial intelligence technologies. The voices you hear in this program are synthetic, and the thoughts they express are shaped through artificial intelligence-driven reasoning and iterative refinement.
Welcome to Radio AI. So imagine this scenario. You're hit with a medical emergency. And that first thought isn't just about getting well, it's about the bill, the potential cost. It's a tough reality for so many people, and it really brings us straight to our deep dive today. Should the government step in and provide free health care for everyone?
Yeah, and it's a question that, it goes way beyond just the pounds and pence or dollars and cents. It digs deep into some pretty fundamental ethical territory.
Like what exactly?
Well, things like how much autonomy do you, the individual, have over your health choices? But also, how much do we as a society look out for each other? Solidarity, you could call it.
Yeah.
And of course, the really hard one. How do we fairly share out resources that are, let's face it, limited?
Right.
So our aim today is to kind of unpick the arguments, look at the different ways this plays out in the real world, the consequences.
Okay, let's start with the moral case then, because there's a strong pull towards universal care, isn't there? It sort of taps into that basic human thing. We all get sick, we all suffer.
Absolutely. That shared vulnerability, that sense of collective responsibility, that's really the core of it. The argument is basically that your health shouldn't hinge on how much money you have.
Makes intuitive sense when you put it like that, like seeing a neighbor collapse. You wouldn't ask for their credit card first.
Exactly. Or think about, someone dying from an infection that's easily treatable just because they couldn't afford the medicine. For many people, that feels like a massive ethical failing, something society should prevent.
Okay, but then the flip side, if we say healthcare is a right, an unlimited right, we run into some pretty immediate practical walls, don't we?
We do. That's where it gets complicated. You've only got so many doctors, nurses, specialists, only so much high-tech equipment. And rationing becomes a real issue. How do you decide who gets what when demand potentially shoots up?
And that's the concern critics raise, right? That free at the point of use sounds great, but it could swamp the system.
Precisely. The fear is longer waiting times, maybe compromises on quality, perhaps even rationing of certain treatments. And there's also the moral hazard idea.
Like that car insurance example you mentioned earlier.
Sort of, yeah. If there's no direct cost to you for using a service, maybe you use it more often. Or for things that aren't strictly necessary. Low-value interventions, economists call them. Doesn't mean people are bad, it just means incentives matter. Which is why designing the system well, the rules of the game, is so crucial.
So how do different systems manage the money and the flow? We came across things like DRGs, diagnosis-related groups. Can you unpack that a bit? What's maybe surprising about it?
Sure. DRGs are quite clever, actually. Basically, the hospital gets a fixed amount of money for treating your specific diagnosis, say pneumonia, no matter how long you actually stay.
Ah, okay. So it encourages efficiency.
It does, yeah. But the potential downside, the perhaps surprising bit, is it might create an incentive to discharge patients, maybe a little quicker than is ideal sometimes, affects the patient experience, potentially. There really is no one-size-fits-all model.
And economically, healthcare is just different, isn't it? You mentioned information asymmetry.
Hugely different, yeah. Information asymmetry is key. Your doctor simply knows far, far more about medicine and your condition than you do. That imbalance affects everything. And it leads to other weird market issues like adverse selection in insurance.
Where only the sickest people sign up, pushing prices up.
Exactly.
Yeah.
It can make insurance markets unstable or unaffordable for healthier people.
Yeah.
These are the kinds of market failures where government intervention might help, but sometimes intervention creates its own problems too.
Which leads us nicely to the different models people try, purely public systems versus largely private ones, or these mixed pluralistic approaches.
Right. And those different models often trace back to different philosophies. You've got the egalitarian view. Health is essential for fair participation in life, so access shouldn't depend on your bank balance.
Okay.
Then you have, say, a more libertarian perspective, emphasizing individual choice and responsibility, often wary of too much government control.
And the system design has to somehow juggle these.
It has to try. Reconciling these deep values, equality, freedom, efficiency, with the messy practical realities, that's the ongoing balancing act.
And these systems don't just sit still, do they? They evolve. Public expectations change.
Constantly. Technology is a big one. It offers amazing cures, but Wow, it can be expensive. And systems can get kind of stuck in their ways, what academics call path dependency. Hard to change course once you're set up.
So adaptation is key.
Absolutely critical. You need ways to get feedback, evaluate what's working, and adjust, especially in societies that are changing, getting older, more diverse. What worked 30 years ago might not fit today. You need sort of institutional humility.
So wrapping this up, it feels like the whole question of government-funded, free healthcare, well, it doesn't really lend itself to easy answers or slogans, does it?
Not at all. It forces us, you included, to constantly grapple with our ethics, the hard facts on the ground, and those unavoidable trade-offs in how we set things up.
It demands that ongoing critical look.
Yeah. And maybe the best way isn't a fixed blueprint, but more a process. Continuous learning, adapting, negotiating those tensions, and being willing to admit when things need fixing.
Well, this has been a fascinating deep dive. Thank you for joining us on Radio AI as we've explored this really complex issue. We genuinely appreciate you spending your time with us.
It's been a pleasure.
And please do share any thoughts or reflections you might have in the comments section below. Hope to have you with us again on Radio AI. Until next time.